Hello and welcome back to another episode of the Active Life podcast with me, Ed Thompson, author, physiotherapist and clinic owner. And today we're talking about injections for arthritis. Now, it does seem a bit like a silver bullet. The idea of being in lots of pain, having a jab and being in a lot less pain fairly quickly afterwards is very appealing. You know, if I was in that situation, I had a holiday or I was walking someone down the aisle, that kind of thing would be quite attractive to have a go at. But today we're going to talk about the research. We're talking about how we could use injections, thinking about PRP, hyaluronic acid, corticosteroids, and even something called arthrosamid, which is something else we'll talk about as well. So we're going to start with corticosteroids. Now, the idea is that this is where we use steroids to inject into a joint, and that basically dampens down cytokines and prostaglandins, and that is where the benefit is. So it helps to reduce inflammation and swelling and therefore pain. The research typically shows good short-term effects, but long-term not much carryover. So there was a study in Switzerland that looked at 120 patients, compared PRP, HA, which is hyaluronic acid, corticosteroid and placebo, and there was good short-term effects initially, but compared to placebo, the outcomes were the exact same at 6 months. Now, this is a fairly high-quality trial and demonstrates its use in maybe a flare-up when you've got a particularly bad case of pain and the joint that is affected by osteoarthritis is really angry. It could be quite a useful tool in that sense, but as a long-term strategy, not so good. Next injection that we've got is hyaluronic acid, which is which we abbreviate to HA. Again, in that same study, benefits weren't that great, compared to placebo. So injecting saline, which is salty water, the effect was very similar. The idea of HA is that your body produces HA and it's a natural lubricant in your joints. So the idea is if we inject more of it, the joints are going to be more lubricated. It may even help with reducing inflammation. But actually, there was also a bigger study that looked at lots of other studies, and what they found was that most of the studies into HA with very small sample sizes, and the quality of those studies weren't very good. So therefore, the results are inconsistent, and therefore we can't rely on them to say that there's a significant benefit to using it. That doesn't mean it doesn't work on anyone. It means that the NHS doesn't recommend HA, and I think the NICE guidelines may have said that it's actually only recommended in research settings. So there's still more research that needs to be done into that, but the next type of injection is PRP. Now, this is what's known as platelet-rich plasma, and this is where we would take in kind of a sample of blood and then use this centrifugal machine to get the plasma out and then re-inject it back in the joint for it to have a bit of an anti-inflammatory effect and to help try and boost repair. Now, there are some studies that show it has no comparative benefit compared to placebo. One in Australia in what's known as the RESTORE trial, with 288 people with knee osteoarthritis, half received PRP and half received placebo, so salty water again. And after 12 months, there was no difference between the two groups on pain function or cartilage thickness. A separate meta-analysis, which is where we're looking at multiple studies, found that looking at 42 trials and over 3,000 patients worldwide, that meta-analysis showed inconsistent results and not strong enough results to be reliable enough for it to be recommended on the NHS, for example. Arthrosamid, now that is a type of injection where it is, I think, 97% water and then 2.5% of something called polyacrylamide. And the idea of it is that it basically is non-biodegradable, so it basically stays in your joint and acts as a permanent cushion. Now, 2 studies have been done into that treatment, one in 2018, one in 2020, both open label studies, so that means that they are, the patients are aware of what treatment they're getting, both funded by the company. Both did show pain and function scores improved and stayed better at 12 months, but there's lots of bias and the quality of that study isn't very good. So again, we couldn't really hang our hat on that as an effective treatment. It's also between £3,000 and £5,000 as well, so it's quite expensive, and it's again too early to say that it really is a silver bullet or a home run type treatment just yet. What we need in that field is better quality studies with bigger sample sizes, bigger comparison to placebo, and we also need the participants to be blinded, because all of those different factors, and also have more independent researchers, because there's all sorts of biases there. It's the same reason why we don't have a English refereeing an England game, because there's lots of biases and that can skew the results. So my tip is, don't be disheartened by the research that we've covered today. Use an injection as a tool and think of it as a way to calm down your pain, so that enable you to participate in physiotherapy, strength training, regular activity, regular exercise, and that's where it can be quite effective and quite helpful. Sometimes in the treatment room, sometimes in the clinic, if someone's in so much pain we can't do very much, and an injection can be quite helpful because it allows them to participate in the work that we need to do. But as a standalone treatment, repeated injections, particularly steroids specifically, has been shown to cause further cartilage thinning. So we have to be careful with how much we use steroids. And as a standalone treatment, just using one of those injections we've covered today might not be the best strategy. So after today's episode, if you are thinking about using an injection, speak to your doctor, speak to the different people that may administer the injection to weigh up the risks. For example, one of the risks is obviously infection with any injection, and think about how it could fit into your overall bigger picture management of osteoarthritis. Download our free toolkit today. It's an arthritis toolkit. Hit subscribe, hit follow, and you'll be able to access the next episode and get notified. And on the next episode, what we're going to be talking about is joint replacements. So we're going to be talking about when to just go for a joint replacement, what criteria we might use, and how effective they are when we look at the research. So look forward to seeing you on that next episode. Thanks for watching. Take care.